The information provided in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult with a qualified medical professional. Thank you for your attention and enjoy today's episode. What is up, good people of the internet? My name is Tony, and you're currently tuned into HempNerd, the podcast that clarifies how safe and effective cannabis therapy is so you can have a smoother road to recovery. Now, in today's particular episode, we're going to be answering the question, what is the side effect profile and safety profile of CBD? Now, for those of you who are not familiar with the HempNerd podcast and how I like to handle things on this show or on this podcast, normally what I like to do first is understand exactly what it is that I'm looking at. So very briefly in today's episode, we're first going to look at what CBD is, and then from there we're going to quickly shift the conversation to looking at the side effects and safety profile. For those of you who are familiar with the HempNerd podcast, you know what time it is. So sit back, relax, and let's get into today's episode. So where we're going to kick things off is answer a very obvious question, which is, what is CBD? What is cannabidiol? So CBD is a component of the cannabis sativa plant, or I would even go as far as saying cannabis sativa, indica, and ruderalis. It makes up about 40% of the herb extracts derived from one of the aforementioned variants of the plant. Now, CBD, as I'm sure everyone pretty much knows by now, but if you don't, here we go. CBD is so it's non-psychoactive, so it doesn't actually get you high. It's the non-psychoactive part of the plant. Unlike THC, which everyone knows is the part of the plant that actually gets you high. CBD has multiple therapeutic actions, which include, but are not limited to, anxiolytic, which basically means reducing or preventing anxiety; antipsychotic, which means reducing or preventing delusions, hallucinations, paranoia, and disordered thought; antiemetic, which means reducing vomiting. We have anti-inflammatory, which we all know means reducing or relieving inflammation, redness, and swelling. It is analgesic as well, which is basically it means it's a pain relieving. It is anti-epileptic as well, so it reduces seizures. It's neuroprotective, which means it protects or preserves nerve cells against damage, degeneration, and impairment of function. And it's a sedative as well, so it promotes calmness and induces sleep. So that's just like an overview of what it does. There's a few more things that we're yet to discover that it does as well. However, CBD was first isolated in 1940. Its chemical structure was then identified 23 years after it was first isolated. Since then, a lot of published articles have actually come out dealing with its chemistry, its biochemistry, its pharmacology, and its clinical effects. However, its safety and side effect profile in humans is mostly assumed that it is safe, and for good reason, because the cannabis plant has caused 0 deaths in human history so far. However, with everyone making the claim that it is safe, there's not many people that actually do have some clinical scientific backing up their claim. So that's what this article is, or not this article, because I'm actually reading off the article that I wrote, which you can check out at HempNerd.co. However, with what this podcast what this piece of content in this podcast and this video, if you're watching this on YouTube, what it's meant to do is to provide clear data and clear research and data, basically answering the same question as to the side effect and safety profile of CBD in humans specifically. So, what is the safety and side effect profile of CBD? Well, CBD is clinically considered safe in humans as well as animals as well, but obviously today's content is focusing on humans, so it's considered clinically safe based on advances made in administration. Multiple studies do suggest that CBD is well tolerated and safe in humans at high doses and even in chronic use as well. However, many studies have also shown that CBD has a strong potential for metabolic drug interactions. So if you've been listening to or watching my last few episodes, you know that I've been talking about how risky it is for you to take CBD oil with let's say an antidepressant drug at the same time, and then I've been laying out a strategy for you to actually do that so you don't cause any negative drug interactions or cause any liver failure. And that's what is being highlighted as well in these studies, that it is safe for human consumption, but it has a very strong potential for metabolic drug interactions, right? So this indicates, right, that there is a need to be careful when administering CBD to human patients, especially those who are taking other forms of medication, other drugs. Now, in order to completely or fully or clearly actually answer this question, we actually need to look at the results of, I would say, 2 clinical studies. In the article, I've written 3 clinical studies, but really we're looking at 2. The one published in 2011, which was the review of the safety and side effect profile of CBD, and one published in 2017, which was an updated review of the same safety and side effect profile of CBD. So let's start with the 2011 review summary. So what I'm providing you is just a review summary, because the actual study went into animal results, it went into human results as well, and then it highlighted certain effects. Of course, our focus with this episode today is just to look at the side effects of CBD in humans. So in 2011, researchers set out to investigate the safety and side effects of CBD in humans and animals, of course. The researchers reviewed medical papers published where only CBD was used. Okay, so they were looking at just CBD isolate. They're not looking at broad spectrum, and they're not looking at full spectrum. So they were not including any of the other cannabinoids, just CBD. The researchers excluded medical papers that included other cannabinoids such as THC. In total, the researchers ended up with 132 different medical papers to review. And to also help them zero in on the side effect and safety profile of CBD. So the researchers found, this is just an overview, so the researchers found that in human studies, CBD administration across a wide range of dosages did not induce side effects, and a tolerance of CBD did not develop in patients, right? So the studies reviewed were conducted on both acute and chronic dosages or dosage regimes, which basically means short-term and long-term. I guess what proceeds from this point is just a slightly detailed summary of what the researchers found. All right, so let's see. In human acute studies, CBD was either taken orally or inhaled or via injection, and it did not show an onset of negative or ill side effects in either one of those administration forms. So again, that was orally, inhaled, or via injection. Instead, the researchers found that CBD does not interfere with severe psychomotor and psychological functions in humans. So just think of things to do with your brain and what your brain controls. And they also found that CBD does not affect your heart rate, it does not affect your blood pressure or learning and memory performance either, at even dosages as high as 600 milligrams, which is quite a lot of CBD. And in addition, antipsychotic studies where CBD was utilized did not report any side effects after CBD intake. So antipsychotic, think of a condition like schizophrenia, for example. If someone had schizophrenia, maybe even I think bipolar fits in that one as well, where they were using CBD. No side effects were reported in any of those. In human chronic studies, CBD taken orally at 10 milligrams daily for 21 days did not induce any changes in neurological, clinical, psychiatric, blood, or urine examination. So prior to taking CBD and after taking CBD, no changes were noticed. Everything was still the same. In healthy participants and epileptic patients, CBD administered daily over 30 days and 135 days respectively. So in healthy patients took it for 30 days. Epileptic patients took it for 135 days. CBD was well tolerated in both situations, right? No signs of toxicity or serious side effects were detected in either of the groups, and when undergoing weekly neurological and physical examinations, blood and urine analysis and other clinical examinations gave them the all clear. It was all good. Now, CBD's safety and effectiveness to relieve symptoms was evaluated in 15 patients with Huntington's disease, who were neuroleptic free. So being neuroleptic free means you don't take any meds to depress any nerve function or suppress any nerve function in order to reduce any nervous tension that you may have. And the patients were split into 2 groups. So group 1 was administered CBD at 10 milligrams per kg of body weight over a period of 6 weeks. Group 2 was administered with sesame oil again over 6 weeks, and that was the placebo. CBD showed no significant clinical differences in the cannabis side effect category, clinical lab tests or safety outcome variables compared to sesame oil. So what they're trying to say there, that's a very fancy way of just saying that CBD didn't show any differences to sesame oil. Now, when you look at the side effects, what are the side effects of sesame oil? Nothing. What are the side effects of CBD? Nothing. And they looked at lab tests and safety outcome variables that I don't know what those specific variables are. I'd have to go deeper into that study to find them out, find out about them. But what we want to know is, were there any side effects? And of course the answer is no. So this is going to be a consistent pattern. Like, you're going to get the joke as we go deeper and deeper into this. But with every single study, more or less, like, CBD doesn't cause any side effects. Anyway, let's move on. In a single patient case report, a teenager diagnosed with schizophrenia experienced severe side effects after receiving treatment with conventional antipsychotics. So existing pharmaceutical drugs that treat psychotic conditions like schizophrenia, they were already experiencing severe side effects from doing that. So that when the patient was hospitalized, they received 4 weeks of CBD treatment at increasing doses of up to 1,500 milligrams per day, and the patient showed significant symptom improvement with no negative or adverse side effects. All right, so they were to me, that one was interesting. Like, it makes me laugh as well. So this patient was diagnosed, and this was a teenager as well, was diagnosed with severe schizophrenia, or just with schizophrenia. They were taking regular pharmaceutical drugs, antipsychotic medication, and that they were experiencing severe negative side effects. They were hospitalized. 4 weeks in with CBD treatment, doses as high as 1,500 milligrams per day. That's a lot. Like, think about, the way to think about it is like, if you think about how the current, I don't know if you can call them suppliers, online retailers, right, who actually sell CBD oil. They'll sell you a 30 ml bottle, and that 30 ml bottle is said to have the equivalent of 1,500 milligrams of CBD in that bottle. So that person is having that one of those every day. Like, they're basically having 15 milligrams of CBD every day. That's a lot, right? That's a lot of CBD oil. And they did that for 4 weeks, and there were no side effects. Like, again, no negative side effects, no adverse side effects, and the actual schizophrenic symptoms were improving. So to me, again, I'm just like, man, why isn't this legal? Like properly legal, mainstream legal, if you know what I mean. Similarly, 3 patients with treatment-resistant schizophrenia. So this is people who were taking medication, and whatever treatment they were taking prior to CBD wasn't doing anything. So they received CBD monotherapy treatment. So CBD monotherapy basically means it's the only thing they're taking, right? CBD is the only thing they're taking, or replace CBD with anything else. If someone says they're on whatever thing monotherapy, it just means that that's the only medication that they're taking. The patients started treatment at 40 milligrams per day and increased to about 1,280 milligrams per day for up to 4 weeks. So they increased nearly to the level of that same teenager. And in that time, no negative side effects were reported, not even at the high dosages of 1280. So let's say 1,300 milligrams. So 1,500 milligrams per day over 4 weeks. That's a lot. That's a high concentration of CBD to be having every day. And of course, they're treating psychotic conditions like schizophrenia. So of course, why not? But still, even at those high dosages, like nothing, like CBD produced no negative side effects. It's all good. 2 patients with bipolar disorder mirrored the aforementioned results as well. So like what I've just spoken about, patients with bipolar basically mimicked the same results. They're administered with CBD dosages ranging from 600 to 1,200 milligrams. Again, very, very high dosages and this is per day, not just throughout the entire 4 weeks. 1,200 per 4 weeks is 1,200 per day over 4 weeks. So the bipolar patients received the high dosages of CBD at 600 to 1,200 milligrams per day for up to 24 days. And as well, for them, they did not report any adverse or negative side effects. So again, CBD for the win, right? I'm doing this just to show with clinical data, just how safe CBD is. and cannabis therapy in general. So in a separate double-blind study, 42 patients with schizophrenia demonstrated that CBD administered at 800 milligrams reduced psychotic symptoms significantly, right, after 2 to 4 weeks of treatment. Now, in that time, fewer side effects were induced compared to what they're already taking, which I'm hoping I'm saying this correct, but if not, let me know in the comments below. I think I'm going to butcher it anyway. So they were taking something called amisuprid or amisupride. I'm not sure if amisuprid sounds more medically skewed, but amisuprid is an antiemetic and antipsychotic drug, meaning it's used to help reduce vomiting, delusions, hallucinations, paranoia, and any disordered thinking or thoughts. The fewer side effects that were induced included extra pyramidal symptoms, increased prolactin levels, and weight gains. So those side effects came from amisuprid mixed with CBD. So it could have been drug interactions, or those could be exclusive. I personally believe those are exclusive to amisuprid as well, because as we know, CBD, even at high dosage of 1500 milligrams per day, doesn't produce any side effects. So that's more linked with the antiemetic and antipsychotic drug called amisuprid, which they were taking. Let's keep moving. In a 4-week open clinical trial, the safety and effectiveness of CBD was studied in patients with Parkinson's disease who also showed psychotic symptoms. A flexible oral dose of CBD was administered, ranging from 150 to 400 milligrams per day in the final week of the trial. So they started at 150, and then by the final week of the trial, they're at 400 milligrams. The patients showed a reduction in psychotic symptoms and cognitive and motor symptoms. The patient showed a reduction in psychotic symptoms, and cognitive and motor symptoms were not affected by CBD. All right. So again, no serious side effects were reported during the trial. And then lastly, I think in this section is a 19-year-old female patient with a cannabis addiction received CBD as treatment to eliminate her addiction. The patient received about 300 milligrams of CBD per day on day 1, and 600 milligrams per day split into 2 doses from day 2 to day 10. So like 300 milligrams in the morning and then 300 milligrams in the afternoon from day 2 to day 10. So day 1 was 300 milligrams, day 2 to day 10, 600 milligrams split into 2 administration sessions. And then the patient also received 300 milligrams of CBD, I believe, on the last day. So the patient did not experience any anxiety symptoms, dissociative symptoms, or any improved sleep quality. So the patient was actually able to withdraw from her supposed cannabis addiction, right, with CBD, with dosages as high as 300 to 600 milligrams per day over 11 days. And that's all it took, 11 days, and she had no withdrawal symptoms. Now, of course, this 2011 study goes into more detail. Like it's quite a comprehensive study. It goes into like the certain effects CBD has on the body, which stood out to me. And of course, it also goes into animal studies as well, which gives hope for further human studies as well. But of course, the focus of today is mainly just focusing on the side effect profile that they discovered, because that's what they were looking at uncovering. The researchers from that 2011 study concluded that CBD is well tolerated and it is absolutely safe in humans, even at high doses, as well as with chronic use. So you can take it, you can take a lot of it, and you can take it over a long period of time. Based on what they're found, it's very safe and doesn't produce side effects in humans. However, the data also showed potential drug metabolic interactions. Of course, it also showed potential cytotoxicity and decreased receptor activity. Now, if you don't know, cytotoxicity is the quality of a substance being toxic to a bodily cell, such as, let's say, your immune cells, or let's say something like snake venom, how the quality of the toxicity for our cells. So that's what cytotoxicity means. So this then highlights the need, right, to carefully monitor CBD use in clinical practices, because there's a lot of patients who would already be taking something, and then obviously it would be a good idea to add CBD to whatever it is that they're to treat whatever condition it is that they want to treat. But we have to be careful of what they're already taking, to what the patient is already taking, before we can actually introduce CBD, or how we should introduce CBD so we can prevent the risk of negative drug interactions. In 2017, right, researchers set out to investigate to update the finding discovered in 2011, which we've just gone through. This time around, the focus was on clinical studies that documented CBD's interactions with other drugs. Now, the majority of the studies reviewed were performed based on patients with epilepsy and psychotic disorders. According to the researchers, CBD has a better side effect profile compared to the current drugs used to treat these medical conditions. So what they're saying there, if you haven't picked it up already, is that for psychotic and epileptic conditions, so if you've got seizures and any psychotic disorders, schizophrenia, bipolar, and that whole range, that whole class, CBD has already, like without even going too deep into this, CBD has a way better side effect profile compared to the current drugs that are used in today's medical system to treat these conditions. All right, CBD is way better. And so if it's way better on the side effect profile, it's also going to be way better in regards to improving symptoms, because it's going to improve your symptoms, but it's not going to come with a whole bag of side effects that you have to look out for or you have to like navigate. Yeah, there's no storm with CBD. So what the researchers reckon is that this may improve patients' compliance and adherence to medical treatment, which I believe would be true. Like, of course, people be more compliant to take something that's not going to come with negative side effects. Sign me up, I would. All right. Now, in their update, the researchers found that CBD was mostly used as an adjunct therapy. So adjunct therapy means that CBD was used as an add-on treatment to the primary treatment that the patient was already on. So if they're already taking some crazy drug, CBD was used mostly, with all the studies they were looking at, CBD was used as an add-on treatment to that. So this is where you have to be careful, which is something I've mentioned in previous episodes. You have to be careful when adding CBD. Like, and I've gone through that in previous episodes, like even my last 2 or 3 episodes where I'm talking about, or any episode where I'm talking about, is CBD, can you take CBD with this specific drug? I go into, there's a whole strategy that you can use to safely or to reduce the risk of any drug interactions if you're adding CBD oil to your current dosage or drug regimen. Now back to this study. The most commonly reported side effects as a result of adding CBD to current treatment were tiredness, diarrhea, appetite or weight changes, so appetite gain or appetite loss, weight gain or weight loss. Those are the main ones: tiredness, diarrhea, and appetite change or weight change. The researchers stated that more clinical research is warranted on CBD action on liver enzymes, drug transporters, and interactions with other drugs to see if they lead to mainly negative or positive effects. So in 2017, and this is just an overview of what we're about to go through, right? Because I don't want to like waste people's time. Maybe you don't have time to sit through the entire podcast. But yeah, what they're saying there is that with everything, all the data that they looked at, they found that these are the knowledge gaps that need to be filled specifically for drug interactions. When you take CBD with another drug, what does CBD do with your liver enzymes? Because we all know at this point, if you've been following my content, that liver enzymes are where most drugs are broken down, including cannabinoids from the cannabis plant. And then they also want to look at what the CBD's action on drug transporters. Does it help them or does it hinder them? And then also interactions with other drugs. So how does CBD interact with the drugs that we're currently selling in the market? And of course, the question we want to know is it mostly positive or negative? I mean, from all the results that we can see at the moment, or anything that I've seen at the moment so far, I can confidently say that it's mainly negative, unless you're taking it with a positive drug, which I haven't come across a positive pharmaceutical drug in my life yet. I'm yet to be surprised, right? Anyway, now here's an overview of the detailed findings, right? Let's go into some of the detailed findings. So they looked at a double-blind placebo study, or double-blind placebo-controlled crossover study. Very, 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 very sexy languaging there. The 17 patients were co-administered CBD with fentanyl via an IV, Blood samples were obtained before and after the 400 milligram or 800 milligram CBD pre-treatment, followed by some fentanyl dosages. Multiple vital signs were measured during the course of the treatment, such as blood pressure, respiratory heart rate, oxygen saturation, EKG, and respiratory function. So it's just your vital signs. They're measuring people's vital signs during the course of the treatment. They're monitoring them, as they say, we're just monitoring your vital signs. That's what they're basically doing there. So the researchers found that CBD did not worsen the adverse effects of fentanyl. And co-administration was safe and well tolerated by the patients. The results paved the way for CBD to be utilized as treatment for opioid addiction. That was pretty interesting for that one. So this is through an IV. So I think an IV goes straight into your blood system. Like, I don't think it passes through your liver. I could be mistaken. Again, I'm not a doctor. I'm not a medical professional in any stretch of the imagination, so I wouldn't know. So if there's any medical professional watching this, please let me know in the comments if you're watching this on YouTube specifically, or you can shoot me an email. I've got a professional email now, hello@hempnerd.co. If you shoot me an email there, just enlighten me on this, then that would be great. But the results are the results, right? They co-administered CBD with fentanyl. In fact, fentanyl, we shouldn't even be taking fentanyl. Like I did, if you haven't seen Hassan Minaj's Patriot Act episode on fentanyl, you should check that out. If you're watching this on YouTube, I will link it in the description below if it's still available on YouTube. It is worth watching. I would not be touching that drug regardless. But anyway, CBD doesn't negatively or it doesn't worsen the adverse effects of fentanyl, and fentanyl's got some crazy adverse effects. Anyway, moving on. In a well-known fear conditioning anxiety study, this is a very well-known study, 48 patients received 32 milligrams of CBD. This amount of CBD is well below the levels known to provide any anti-anxiety effects. So they're receiving very low doses of CBD, too low to provide, documented anyway, to provide any anti-anxiety effects. Anyway, CBD was administered either both or after the extinction event of the fear conditioning experiment. So multiple means were used to measure the participants' levels of anxiety, such as the mood rating scale, and the bond and bodily symptoms scale. The study found that CBD enhanced the participants' ability to overcome the stressful memory that the fear conditioning study was creating for them. CBD also showed a trend toward protecting against reinstating that stressful memory that the fear conditioning study created. And on top of that, of course, no side effects were reported during the study. So this study was designed to create a short-term stressful memory. And I think they're doing like electro zapping, and they're measuring measuring their mood before and after and during everything. So normally when you're expecting to be zapped, you start to generate anxiety, you start generating anxiety before the zap happens, because you know it's coming. But then because they took CBD in that moment, in the anticipation of the zap, CBD actually helped them overcome that anxiety that actually gets generated during the anticipation of the zap. So they all, as it says there, it was helping them. It enhanced their ability to overcome that stressful memory because of the previous zap, which was the stressful memory. It was helping them overcome that quickly. So during that anticipation phase of the next zap, they had less anxiety, basically. And that's what CBD was helping patients do. That was the effect. Let's move on. In a small double-blind pilot study, individuals addicted to opioids either received CBD at 400 or 800 milligrams orally, or they also received a placebo as well. The administration occurred over 3 consecutive days. Opioid craving was induced via specific cues 1 hour after CBD administration. So they were trying to induce cravings for opioids. The researchers found that the subjective opioid craving reduced after a single administration of CBD. So they took CBD, they tried to induce opioid cravings, and the cravings went down immediately. Like, they didn't have to wait, and they noticed an effect already. So the effect lasted for 7 days after the last CBD administration. So 7 days after the last administration, they still didn't have the opioid cravings, which was also the length of the study. So the study was for 7 days, but then 7 days after, the effects were still present. And another effect that was reported was that the participants' anxiety levels reduced after treatment with CBD. However, no adverse side effects were reported in the study. So look, if you're someone, if I don't know if you've noticed a pattern already, but if you're someone with anxiety, CBD should be your best friend. Like if you've got social anxiety, general anxiety disorder, or any whatever form of anxiety you've been diagnosed with, if you've noticed a pattern already by going through this content, CBD should be your best friend, because no side effects, and people are reporting, I've got less anxiety now, right? Even synthetic anxiety with that zapping study we've just spoken about. Now, in an 8-week clinical trial 8-week clinical study, 13 minors or youth or children with epilepsy were being treated with clobazam and CBD. According to the study, clobazam's initial average dose was 1 milligram per kg of body weight, and CBD's starting dose was 5 milligrams per kg of their body weight. Now, however, CBD's dosage was raised to a maximum of 25 milligrams per kg of the child's body weight, and the study found that CBD's interaction with liver enzymes caused clobazam to be more bioavailable in the body. This suggests that you can reduce the dosage of clobazam, which, when combined with CBD, which would reduce its side effects. Now, clobazam side effects include tiredness, coordination problems, difficulty speaking or swallowing, drooling, change in appetite, vomiting, constipation, coughing, and joint pain. All right, so that's very interesting. And this is something I've been mentioning in my previous episodes when I'm talking about, can you take CBD oil with this drug? Again, drug interactions and liver enzymes. I always say that if you take CBD with another pharmaceutical drug, it's actually going to it's going to make that drug more abundant in your body because of a mechanism called competitive inhibition. A lot of people call this the grapefruit effect, but it's basically where your liver is metabolizing CBD over the drug, so that drug becomes more available in your system because it's not being metabolized. If it's being made more available in your system, it can increase the intensity of the side effects, or it can increase the multitude of side effects. However, these researchers pointed out that if that's what happens, so you can actually start to reduce the amount of clobazam or whatever pharmaceutical drug that it is you're taking, because when you take it with CBD oil, you don't have to take as much anymore because more of it is being made available. So maybe you can half your dose of whatever pharmaceutical drug you're taking if you're mixing it. If you feel or you have the need to take it, you can take less if you're taking with CBD oil or CBD, because CBD is going to increase the level of abundance of that drug in your body. Hopefully that makes sense. And what they're suggesting as well, if that's the case, if you're taking less of this pharmaceutical drug, there is a high probability or possibility that it's also going to reduce the side effects of that drug because you're taking less of it. Hopefully that sticks. Now, this was a very specific date. On the 15th of September 2015, GW Pharmaceuticals published a press release that described the results of 88 patients with treatment-resistant schizophrenic psychosis, so schizophrenia. The patients were treated with either CBD or a placebo, and in addition to their regular meds, the study found that vital clinical parameters improved in the group administered with CBD, and the number of mild side effects were comparable to the placebo, meaning the patients administered with CBD experienced a positive effect regarding their symptoms and an absence of negative side effects. All right, because with the placebo, it's a placebo, so you're not going to experience anything. Whatever you experience is what you're creating, more or less. But then with CBD, it's obviously doing something. It's the cannabinoid is interacting with your endocannabinoid system, so it's improving your schizophrenic condition, and it's not giving you any negative side effects. Yeah, there we go. And if it's good enough for someone with schizophrenia, I'm sure it's good enough for someone with anxiety and or depression. All right. In a separate study, 23 patients with therapy-resistant epilepsy. All right. So whatever therapy they were taking wasn't working. 23 patients with therapy-resistant epilepsy had CBD added to their regular epilepsy meds. CBD dosage was raised to 25 milligrams per kg of body weight over a 3-month period. The study found that CBD reduced seizure frequency in 39% of the patients, and its side effect report was mild to moderate at best. Side effects reported in this study included appetite changes, weight changes, and tiredness, which we kind of highlighted at the beginning of this section of the episode. So that was it. And that, again, I'm pinning down to drug interactions, because CBD so far, if we look at the pattern that we're seeing, it doesn't induce any negative side effects. And then in a clinical study presented in the American Academy of Neurology in 2015, they saw 137 minors and young adults suffering from various and rare forms of epilepsy. The study lasted 3 months, so that's pretty long. That's long enough to make it chronic or long term. And the patients were treated with a CBD drug called Epidiolex. Nearly 50% of the patients experienced a reduction in seizure frequency during the course of the study. And the side effects reported with Epidiolex treatment included tiredness, that was about 21% of the patients, diarrhea, 17% of the patients, and appetite reduction in 16% of the patients. In a few cases, I believe, severe side effects were reported. However, the researchers are not clear as to whether they were caused by Epidiolex treatment. All right. So in a few cases, there were some severe side effects that were reported. However, the researchers who conducted the study were unsure, or not clear as to whether those were actually caused by Epidiolex, which is a CBD-based form of treatment. In a clinical study examining 21 Parkinson's disease patients, CBD in 2 groups and a placebo was administered. Patients who were administered with CBD received 75 milligrams per day or 300 milligrams per day over a period of 60 weeks. That's a long time. That's like over a year. The study found that the high-dose CBD group showed a significant improvement of their quality of life based on something called the PDQ-39 measurement. So PDQ-39, or the PDQ in that stands for Parkinson's Disease Questionnaire. So, and that measures like the following factors: mobility, activeness of daily living, emotional well-being, stigma, social support, cognition, communication, bodily discomfort. Side effects from the study were measured using what's called the UKU. I can't pronounce what UKU stands for. If you want to check that out, please go to HempNerd.co and read the blog. You're going to find it there. Anyway, what this does is it analyzes the adverse side effects such as psychic or neurologic, autonomic, and other manifestations. Using the UKU and verbal reports, no significant side effects were recognized in either of the CBD groups. So this is people taking CBD as high as 300 milligrams per day over 60 weeks. That's over a year. That's very long term. All right, and the second group was 75 milligrams per day, which is not a lot. And of course, we're treating Parkinson's disease. We know we're not treating something small. And the last study that I have here is in a group of 48 patients, or 48 cancer patients more specifically, receiving stem cell transplant or receiving a stem cell transplant. 300 milligrams per kg of CBD was administered orally 7 days before and 30 days after the transplant was completed. The stem cell transplant came from an unrelated donor to treat leukemia and myelodysplastic syndrome. This was in combination with measures to avoid GVHD, which basically means graft versus host disease. GVHD occurrence was compared with historical data from 108 patients who only received the current standard treatment for preventing GVHD. Patients treated with CBD did not develop any short-term GVHD, and 16 months after transplantation, GVHD incidence was significantly reduced, of course, compared to the 108 historical patient data that they were comparing to. And using what's called the CTCAE, Common Terminology Criteria for Adverse Events, no severe adverse side effects were detected in this either. So as you can see, the pattern here with CBD is, of course, I'm not saying anyone who says CBD is safe is lying. What I'm saying is that it's true, and here is the data to prove it. Here is the evidence, the more than enough evidence, all right, to prove it. 2 studies, one from 2011, one from 2017. And this is just the human side. Obviously, in the studies they looked at the animal side of things as well, because there are people out there, I understand, who have pets who want to use CBD to help with the pet's anxiety or whatever condition the pet's pain. If the pet is going through pain, they want to help with that as well. But right now, my focus with this was just to bring the human study results to the surface, to light, so we can all make sense of it and actually lean on this moving forward. If anyone ever questions us, we can actually lean on this data, stand on this data and say that, look, this is safe. All right, this is actually safe. So to quote the meta-analysis that was conducted this year, 2020, April 2020, CBD is safe and well tolerated by humans. It has next to no adverse side effects. In fact, I would go as far as saying it has no negatives or no adverse side effects based on the available data from clinical trials, which we've basically looked at. Not all of it, but most of it that we have. However, in saying that, interactions with other medications should be closely monitored, which is what I've been saying in my previous episodes. It is safe to take by itself, but if you're mixing other drugs, you have to be extra careful. You don't want to hurt yourself. Various areas of CBD research still need to be extended, of course, because this is still early days. For example, more studies looking at the CBD side effects after chronic long-term use administration are required, although we do have one. We do have one at a 3-month. In fact, we've got two. So one was testing CBD over 3 months, because for me, 3 months plus is what I count as long-term or chronic use. And then we've got that other one for 60 weeks, which was over a year at a high dose of 300 milligrams. And those two studies showed that there were no negative side effects, even at high dosage, chronic use and high dose limits, right? But we still need more. We just need to add more to that pile to win the argument to say that it is actually safe as well for chronic and long-term use at high dosages as well. So we also need more research evaluating CBD's effect on hormones, and because it's scarce, like not many people, no one's actually looking at that. If they are, then I haven't found their studies yet, but so far this is what the people are saying in 2020. Or when I say the people, I mean like the researchers, the medical professionals who are doing this research that I help, so that I can break it down for you guys in the best way that I can. However, despite the knowledge gap that we have, CBD safety profile has been established as being non-harmful for human consumption. It is not harmful at all. And this is irrespective of the condition that you are treating for. So you could be treating for whatever condition it is, CBD is actually safe for human consumption. The only portion you have to be careful of is whether we're using it as adjunct therapy, whether you're using it as an add-on therapy to something else that someone is already taking. That's where you need to be super careful. So if you've got any doubt regarding CBD's safety and side effect profile, or maybe you do say that it is safe but you didn't have any data, hopefully now this gives you enough data and enough peace of mind to go out and say that CBD is safe. You can go and challenge your politicians, you can go and challenge your doctors, or you can challenge your ignorant peers. You can use this information to do that. So it goes without saying, man, CBD is safe. CBD is safe. In fact, even cannabis is safe. It still has 0 deaths to its name. In fact, I would go as far as saying the cannabis plant is safe for use, for human consumption, because if you compare it with pharmaceutical drugs, if you compare it with black market drugs like the synthetic stuff, the tally at the moment is that those, I don't know how many people those drugs are actually killing, but I know cannabis is still killing 0, like hasn't killed anyone in the entire human history. So yeah. Other than that, look, if you are in the market for CBD oil, if this piece of content was helpful for you and you actually want to go ahead now, this has gotten you over the edge and you want to get yourself some CBD oil, please visit HempNerd.co/CBD shops. Again, that is HempNerd.co/CBD shops for anyone listening to this in audio format. On there, I have a list of curated CBD online retailers who I'm working with in an affiliate partnership. That I was looking for another word, but in an affiliate partnership, whereby if you use my links to actually go to their website and purchase CBD oil from them, that will actually support HempNerd, because a portion of that sale actually supports HempNerd. So yeah, if you're looking to buy some CBD oil, use one of our links, one of the companies there. Hopefully one of their branding or the way they position themselves aligns with you, and that in return is a way for you to support HempNerd, so I can continue to bring out information like this. Otherwise, if you've got any questions or concerns or anything that you think I need to cover in the future, please hit me up If you're watching this on YouTube, in the comment section below. If you are listening to this via audio format, please send me an email. Let me know if this information has helped you. Send it to hello@hempnerd.co. That is hello@hempnerd.co. Hello is HELLO. And of course, we know HempNerd.co. hello@hempnerd.co. Otherwise, thank you for your time. I really appreciate it, and I will catch you in the next episode of the Hemp Nerd podcast. Peace.